Hi everyone, it's Tiffany. I am making this follow-up video to Do Women Need Testosterone to answer some of the questions I received about pellet therapy. That is the form of testosterone therapy that I personally receive. Keep in mind that this therapy has been out since the 1930s, so I felt fairly confident that it was a good match for me after going over the pros and cons. But there is other therapy out there. There's injectables and there's creams as well. So, weigh out what's best for your body. Make sure you're talking to your doctor. I can only tell you about my experiences, but we know everybody is different. If you do have additional questions, please let me know. And if you like my videos, be sure to like and subscribe, as I'll be doing additional videos. So let's just dive right in. Let's talk about some of the cons of having pellet therapy. The first is it is a minor procedure that you get done in the doctor's office. It takes about 5 to 10 minutes. So that's the pro, is it's super fast. But it does take about 5 days of recovery. So I can't do squats, no heavy lifting, nothing that's going to dislodge the pellet because you're waiting for it to heal. Another thing is you can't take baths for 5 days, and I am a bathaholic. I take a bath almost every single day. Pretty much every single day. So those 5 days are a little difficult, and I imagine I'm only on my second pellet. So the summer might be a little difficult because we do go to the water park all of the time. But 5 days, I'm sure we can manage. Once you have your pellet in, depending on the amount that you're getting, the dosage, once it's in, it's in. So if you go too high for your first pellet, it has to stay in place for the 3 to 4 months. So you're basically writing it out. So for me personally, I let my doctor know I was extremely sensitive to medication, and we opted to go lower, knowing that I could add more at that 6-week mark. So you can always add more, but you can't take it away. There also is additional supplements that I have to take. One of them, well, I think the only one that I actually have to take is DIM. What that does is as you produce more testosterone, you can produce more estrogen. So this prevents me from creating too much estrogen and then having an additional hormone imbalance. So your doctor will pay close attention to those. I get additional labs done at the 6-week mark, which lets me know where my testosterone is and my estrogen and other hormone levels. You can get an increase in acne. I have noticed I'm getting like little pimples. Honestly, I'm my own worst critic, so I think I notice probably more than anyone else does. You could get a receding hairline. I haven't had that happen. Again, if these things are happening, you can lower your dosage the next time, but you kind of have to write it out. You can get an enlarged clit. Some people say it looks like a chicken nugget. I don't know what that means. I don't have that. I don't know if that'd be a huge con because I think it might increase your pleasure, but maybe somebody else can answer that. Coarse hair. I get one coarse hair right here on my chin and it drives me insane. But you can get more of that. I haven't had a huge issue. I have noticed I need to shave my legs more often, which that's all right. It's not the end of the world. I have had people mention the cost is a con for them. For me, it really just depends. Like I was spending anywhere from $300 to $600 a month on supplements to make me feel better that weren't working. So to spend $350, $400 on a therapy that lasts for 3 to 4 months really wasn't bad. I also have the saying that, you'll always get money back, but you can't get your health. So health is really priceless for me. Some people might not feel that way, and that's totally okay. But in my mind, you can always make more money. So for me, the money wasn't a big issue. It actually ended up saving me money. So let's talk about the pros. I have a huge increase in my sex drive now. It went from almost non-existent to 0 to like 1,000. So that's been really good for like my marriage, and I know my husband's happy. He's got to be. Increased energy. I don't have to nap all the time anymore. Before, I literally had chronic fatigue. I would sleep so much I had to. It was hard for me to get out of bed some days. I don't have that anymore. I feel more normal. I have a sense of well-being. Like I just feel good. My mind is calmer. I don't have brain fog. It's easier for me to recover from workouts. I'm noticing that I'm decreasing in body fat a lot easier and my muscle mass is increasing. And then with the recovery, I can push myself a lot harder. I have also had compliments that I'm looking younger. I don't know. I got a new cream too, but I would like to think that the testosterone is helping that. I am 40. I don't feel it. I feel fantastic. I don't know what you're supposed to feel like at 40. Anyway, those are my list of pros and cons. Again, you will do what's best for you. I just want to answer as many questions as I can and help as many people as I can. If you like my videos, please hit like. Go ahead and subscribe. I'll be doing more about different topics. So thank you for joining me, and you guys have a great day.